Hi, my name is Aaron Turnbull and I'm the CEO and head physio here at Game Time. First of all, I'd like to thank you so much for choosing us as your healthcare provider. And we know there's a lot of options out there, and we really cannot wait to work with you and to help you get back to your best and keep you there. So today, we're going to have a quick video just explaining some different rehab options that we do provide here at Game Time. It is very different to maybe what you've had before when it comes to physio. And these are options that we believe does provide a superior level of rehab and therefore outcomes. So I'm just going to kind of outline what it is today and what we like to call our elite rehab support, or our ERS. So the purpose of today, I'm going to present this ERS and how this has actually helped our patients get incredible outcomes, and explain how it differs to the conventional model and I guess the benefits of going with this option. So if we look at the current rehab model, it's broken, in all honesty. So the traditional method of physio, it's just been happening 50, 100 years, the same thing. You come in, you pay X amount, $100 a week for a physio consultation, and you're given some exercises to do on your own. Fingers crossed you get better every week. The physio has to fit in an assessment, a treatment, education, and exercise prescription all within 30 minutes. And in all honesty, often not doing all of it great. You're then sent on your way to work your way through a list of exercises, unsupervised. Sometimes it's hard to reach your physio asking questions, and it's really sometimes hard to really push through, and everything feels a little bit unclear. Life often gets in the way. Everyone's busy. So the exercises often take a back seat, and then your progress is often slow and frustrating. Surely there has to be a better way. So when we're really asking ourselves this question, one thing we kind of had to have a think about is we get asked a lot, why do pro athletes and pro sport get people back so much quicker? Now, absolutely, the people that work within these organizations are absolute guns at what they do, very knowledgeable and experienced therapists. But one of the big things why they get such great results is just the contact time they have with these athletes. You know, they go into their club every day, a few times a week, and they're able to access all their facilities, all their professionals to really accelerate their rehab and get really good outcomes compared to your conventional model, what we do in private practice with that one weekly consult. So what we've done is we've gone away, we've seen what we can do and with the facility we have here, and we've created our elite rehab support, which we believe really is the best level rehab here in Brisbane. So what is it? It's an absolute game changer for our patient community, and it's tried to replicate the frequency of rehab that professional athletes have access without breaking the bank. And I want you to think of it like a gym membership. So instead of paying your $100 for a one-off consultation or like a workout, you pay for a certain level of access to our facility, okay, enabling you to access certain services within our facility on a weekly basis. Just like a gym membership, we have different levels of support depending on you, your situation, your injury, and your goals. All these services can also be claimed back on your private health and sporting insurances, so whether it be a physio consult, a myotherapy consult, our recovery room, or our supervised rehab sessions down in our gym. Patients can now take their weekly contact time with their physio from the usual 30 minutes to almost nearly 3 hours, absolutely maximizing outcomes and satisfaction. So if we take, kind of explain this with a bit of a real world example that we see a lot. Let's take a grade 1-2 ankle sprain with a 6-week sort of rehab. The old way, you're going to pay $109 a week for a 30-minute consult. First couple of weeks, you're looking at symptom management, more the manual therapy side of things. It's quite, I guess, easier exercises, building to more your weight-bearing movements within that second week. Week 3 and 4, continuing a bit more hands-on, getting that range of motion back. We start to do some single leg work at home, some force absorption, and maybe, I guess, like a home gym program, and starting to introduce maybe some little bit of bounding as it allows. Week 5 and 6, progress that gym training. Then we try ramp, squeeze in some running and change of direction progressions, trying to build intensity, get them go back to training. Lots going on. Probably not doing much well, in all honesty. Over that 6 weeks, we've got a total contact time of 3 hours, and all the rehab is outside of the clinic. unsupervised, outside that 30-minute consult a week. And often there's a lack of progression because you're waiting a week to get a new set of exercises. So if we look at the ERS for the same ankle sprain, okay, now this little table should look pretty familiar from your initial consult with your physio. I'm going to explain how it looks like and how that level of support and the services within it actually change as your needs require. So if we look at our best level of rehab, our level 3, okay, it's $149 a week, so only $40 more. Now, the first 2 weeks, it might look like 2 one-on-one physio consults, okay? So being able to do the hands-on side of things and progress those easier levels up a whole lot quicker, improving that range of motion, getting your pain levels down, and kind of ticking off those first 2 stages of your rehab. Then we look for that weeks 3 and 4. We're bringing it back to only a weekly physio, all right, as we get into our conditioning phase, but then we're going 1 or 2 supervised rehab sessions, which we have 20 a week available, that they can come in, do the work on other areas that aren't injured, make sure they're maintained, whether it be fitness, strength, anything like that, but then working on their rehab at those higher levels and speeding up their recovery. Then at the kind of that resilience phase or that last phase, we're really zoning in on those higher levels of loading. Okay, so depending on your goals, if you want to get back to high level sport or playing, training 3 times a week and playing a game on Saturday, the load might be here. We need to make sure that our rehab is getting us up to that. So if we look at that week 5 and 6, it might look like 2 or 3 of those rehab sessions. And then coming and seeing Joe, my therapist, more the hands-on recovery side, because you'll be working a little bit hard now in your rehab. We're going to make sure that we're balancing that recovery and rehab at the same time. Now, on the low end, your rehab time has now gone to 8.5 hours over those 6 weeks, all the way up to 11.5 hours. Now, for only $40 more a week, patients now receive on average 3 times the rehab contact that they had if they followed the normal model, at a rate that's less than half the hourly rates that you would have to if you paid for all these services as you could go. Now, we know that there are, that's not going to be for everyone, absolutely not. Being able to come into the facility 3 times a week might be too much. So we do offer some other ways that do move towards our new way of doing things to fit everyone's life, goals and expectations of rehab. So with our second level, so ERS2, a little bit cheaper, that $129 per week. And this is designed for more your long-term injuries and post-operative rehab. So when you don't need to be seeing a therapist every single week for a one-on-one, and maybe we're prioritizing more of those supervised rehab sessions that your physio has been programming specifically for you. You have a fortnightly physio consult where they might be doing some manual therapy, some testing, revision of your program, and you have unlimited rehab sessions there. So that's a really good one for, say, your ACLs, long-term tendon issues. Really good option there. Then we have our ERS1. So this is our conventional model that you've probably seen and experienced before. But what we like to do is if you can commit to us and commit to what your physio has recommended, we're going to take $10 off a week. All right. What this gives you is that you get a weekly physio consult or unlimited rehab sessions. So some people come in from more just that ongoing rehab or towards the end of their rehab. They say, hey, the one-on-one aspect's probably all right. I'm going to see you personally in the class because I'm taking that class. Let's just focus on those rehab sessions to increase that volume of the rehab, getting more bang for your buck. Now, any additional services that we need on the side or anything like that, we pretty much slice that price in half as well. We want to kind of give you absolutely every resource we can to make sure you get a good result. Because in the grand scheme of things, if you get a great result, you're going to tell your friend, and if they're ever looking for a physio, you're going to come see us. So that's the way we want to do things. Now, this is not a compulsory option. We do think it is absolutely, I guess, the best little rehab out there, but it's not compulsory. You don't have to do it, and it is not for everyone. But if you are committed and you really want to get this incredible value from these options, it is a commitment. It is a financial commitment. The girls downstairs, they'll be taking details just so that they, when you sign up for, say, your physio said 6 weeks, that 6 weeks will come out. It's not something we can kind of back out of. If you're committed, hey, you're going to get incredible value, but just so you know, it is that commitment. All right. Obviously, circumstances can change. We are compassionate to that, but just so you know that that it is a financial commitment. So I hope you got a lot out of that. Now your physio will be bringing up these ERS options within your follow-up consult. If you have any questions, please write them down. Your physio will be happy to answer them. But we really hope that we can help you get back to your best and keep you there. And we look forward to seeing you at your next appointment.